Hi, I'm Illinois Treasurer Mike Frericks, and Doris Carroll is the Treasurer's Office Women's History Month Award winner for outstanding achievement in workforce and labor. Doris Carroll, a recent past president of the Illinois Nurses Association, vice president affiliate of the Illinois AFL-CIO, and a delegate with the Chicago Federation of Labor. She's been a registered nurse for 37 years and works full-time as an administrative nurse at the University of Illinois Health, serving the west side of Chicago in an infectious diseases primary care clinic for adults and children. As the co-chief steward at UIH, along with her other obligations, she's a founding member of a grassroots national nursing organization, Nurses Take DC. They're dedicated to passing federal legislation for safe patient limits. She's also a proud mother of 2 children, owner of several Black rescue cats, and a fierce union leader. She will be retiring this year to care for her 86-year-old mother. So Doris, welcome. Maybe you could start off by telling us why you decided to become involved in the Illinois Nurses Association.
Thank you. Thank you so much for that introduction. So being a nurse for 37 years, I really have always been a member of the Illinois Nurses Association because our union has been here at University of Illinois for 40 years. But I really didn't become involved directly until about 13 years ago when I realized I was in a situation at work which was very uncomfortable, and it resulted in me taking care of this 2 per nurse clinic and caring for patients under 35 physicians. And that was quite difficult. So finally, I reached out to my union, the INA, and we made things happen. And so I wanted to give back. I wanted to give back to nurses who understand that, who feel very committed to patient care, but the employer can be a little challenging at times in order to provide safe patient care. So that's why I feel strongly that I needed to give back and get involved. I ended up starting at the bottom and worked my way up to the president of the Illinois Nurses Association in order to provide the best quality patient care and also provide protections for nurses in the workforce.
Okay. I think we accomplish a lot more working together than we do individually. But I find that a lot of young people I talk to don't really understand what organized labor is. Can you tell us why you believe in the importance of the labor movement?
Well, that is the problem. Young people need to understand the history of the labor movement, where it started. And that's how we learn, how we see what the mistakes were made, and how we improve the quality of life. And I'm not just talking for nurses, but absolutely for all people who work. And this is not, employers do good, but they usually do good for themselves. And so it's an economy that's run on capitalism, which is important for the economy, but it's not relevant and it's not safe for workers. Nurses and those in the labor force need to organize, to understand that in order to make change in the workplace, you have to work together, you have to come together, and this provides the protection that is needed in order to have a safe workplace. And in nursing, what we do is if you have a safe workplace here in our hospital or in the clinic system, then you have and are providing safe patient care. It does equate to that. We have already 2 decades of research to prove that having enough nurses does impact on outcomes, and patients live longer, are in the hospital less, have less infection and less heart attacks and death. So if there's enough nurses in the workplace, then patients will have the best quality of care. And that relates to the labor movement, because we need to make sure employers will not staff a hospital with the most number of nurses. They staff it in the most leanest way they can. And this is not rocket science. but we do have the evidence-based research to prove it.
Even in normal times, it is important to work together. There are obstacles to overcome. But today, we're not in normal times. Nurses are on the front line of caring for people as we fight this ongoing pandemic.
Right.
Can you share with us how this pandemic has impacted the lives of your members?
Well, obviously, it's been very traumatic. I think that we will face in the future how we look back on these times as we did with what happened before 9/11. And we are already having that conversation about pre-COVID times. It has changed the face of providing health care, and it obviously has led to many deaths, over now 500,000 deaths in the United States. This is an incredible time for the country to move together to make change. And it has shone a spotlight on what is wrong with the delivery of healthcare in our country. And what we've seen is the disparities, the inequities in those populations who suffer the greatest: people of color, people who are poor, people don't have the resources. And what we've done here in Illinois and in many states across the country, the research, as I mentioned earlier, shows that evidence-based research is needed to prove that if you have enough staff in a hospital, you can provide the best quality of care. Well, guess what? Then we had a pandemic, and it really showed that we didn't have enough nurses at the bedside. And what now we have to do is look to our legislators to ask that question. This is the time that we have. We've shown you what is needed. We have the research, and then a pandemic happened and showed the whole world what happened. So our nurses are suffering from PTSD. Here at this hospital, we had 2 nurses die. It was pretty horrific. I don't work on the front line, even though I'm in the infectious disease clinic, but I represent nurses who do. And I'm telling you, every day, listening to their fears, their crying, the amount of deaths that they saw, it's not something that people can easily withstand. We will be suffering for a long time in this country.
Yeah, these are difficult times, but I would like to end on perhaps a little more positive note.
Sure.
So, Doris, maybe you can tell us, what are some of the successes in your career that you are most proud of?
Well, I am very, very proud of the fact that our hospital, as the co-chief steward with my other co-chief steward, Paul Pater, he works in the ER, we were able to show the hospital that we need to protect our nurses. And we did that by constant communication. We had daily phone calls with management as far as how they were staffing the units. And we insisted on universal masking, and we won that prior to the CDC and the WHO mandating or recommending that 1 week before. So we were the only hospital in the country that were having all employees wear masks, and I'm very proud of that. And secondly, I'm very proud of the contract that we won right at the end of the second surge of the pandemic. You know, most people would say, how can you go out on strike in a pandemic? Well, management was really, even though they called us heroes, when it came to renegotiating our contract, we really knew what they felt about us. And we decided to take action. And we were in negotiation, many sessions, and we finally came out with a contract only after we went on strike. And that was the most defining moment of my career and many nurses' careers here at University of Illinois. And it showed the state of Illinois and the country what the labor movement can do when people are organized to make change. And we did get an incredible contract that includes a 90-day rolling count of PPE, and also safe staffing commitment from the employer. which essentially translates into safe patient limits, which really means having enough nurses to take care of the patients in a hospital. So I'm very, very proud of those two things. And I'm also proud at the federal level of being a part of a grassroots organization, Nurses Take DC. We are fighting for federal legislation for safe patient limits. And I think in the next year or two, we have shown the importance of having nurses at the bedside. Now let's have the public and our legislators do the same and honor us or pass that legislation so that we can all be safe and that our loved ones can be safe.
Great. Well, Doris, thank you for joining us today, for giving us your insights, and for your leadership in Illinois and the labor movement. I really appreciate it.
Thank you so, so much, Mr. Treasurer. I really appreciate your time, and I am honored for this award, and I hope young people will stand up and do the same. Thank you.
Great. You've been doing this for a long time, but we'll let you get back to work.
Okay, thanks.